If you're a board member of a hospital or healthcare system, you must be sitting there in the early part of 2011 wondering, what should we be doing about healthcare reform? Yes, the politicians are talking about rolling back some aspects of healthcare reform, and others are talking about adding to it. Let's set the politics aside for a second, and let's talk about what is prudent for a healthcare board to be thinking about in these times. First of all, without any reference to partisanship, let me suggest that some form of healthcare reform will happen and will be implemented. We need to talk about timelines because this stuff doesn't really kick in until 2015 for everyone in the country. Only a few hospitals, maybe 24, will be involved in demonstration projects that run from 2012 to the end of 2014. The rest of the hospitals will be sitting there on the dock, watching these organizations, listening to rumors and innuendo about what's working and what isn't working, trying to figure out what to do. And if you're a board member with fiduciary responsibility for this huge community asset, you should be asking a lot of questions of management. First, you should ask, what's our plan? What are we going to do? Are we going to jump on this demonstration? You could get turned down, but you could also apply and perhaps end up a demonstration project. But if you don't, and you're sitting there on the dock watching other people, what should you be doing? Well, I think a couple of things are essentially no harm, no foul. Number one, everybody's talking about putting the hospital employees into a group that is managed by the physicians. Okay, yeah, doesn't hurt, might help, remembering that hospital employees are net high users of healthcare, so they're not prototypical consumers by any means. Secondly, people are talking about buying up doctors. Yeah, well, maybe that's a good strategy, although I'm aware of physician management groups that claim the existing number of physicians could literally double the number of patients they serve without straining and with the help of organizations. So bidding up the price to get numbers that may or may not be necessary needs to be looked at with some degree of jaundice. Besides, haven't we screwed that whole thing up 2 or 3 times already? Maybe it'd be a good thing to take a hard look at those plans if you're a board member. Then there's finding the right talent to lead your organization's effort in accountable care. This isn't some little project that the CEO can run out of his or her back pocket while they're managing a multi-$100 million, maybe billion-dollar organization. And this isn't something you want to put the newest administrative resident on, because you're in effect betting the whole future of the organization on how well you put together your ACO. So talent is a terribly important element in the early going. And I think the organization has to make some fundamental decisions about how it's going to approach an ACO. Is it going to build its own? Is it going to join some other larger organization that has the resources to create one? Is it going to sit around and watch all this happen and hope that it all blows over? I'm sure there are a few of those, but I don't recommend that. Or is it going to try and find other organizations nearby, maybe even old competitors that you can work with and create an organization of shared expenses that allows you to go forward and build better quality? These are questions I think the board needs to ask, all the while hoping in the short run that your administrative team is developing the resources to fund this activity.